Scan Health Can, the podcast where we explore the crucial role of the healthcare supply chain. I'm Dana Trampas, your host. Each episode is a new chapter in the exploration of best practices, innovations, and advancements, ensuring that at the end of the healthcare supply chain, we prioritize the most vital element, human life, and understanding the people behind each link in the healthcare supply chain, which is why I'm incredibly excited today for our guest, Anne Snowdon, the CEO and fearless leader of Scan Health. How are you doing today, Anne?
I'm very well. Thank you so much for having me today.
Today, we're going to take some time to reflect back on the transformative year that we've had in supply chain, and as well as reflect upon all of the episodes that we have recorded for Scan Health Can podcast. So, Anne, as we reflect on this past year, what has been the most significant or surprising development that you experienced or stands out to you?
Yeah, when I really look back, I always start with, what have we learned about supply chain resilience in health systems? And from the very early days of this community practice, I think we've had substantial lessons learned, insights, maybe even aha moments that set the stage for where we're now going. And that is, so now that we've learned those lessons, how do we actually move forward on putting those lessons to good work and advancing the solutions everybody needs, every Canadian needs health systems to achieve to advance supply resilience? So let me give you a few examples. We've learned a lot about the deep knowledge and expertise in very specific and, quite frankly, unique supply chain experts in Canada. Industry has phenomenal expertise in how the supply chain works and how they get those products from manufacturers to where they need, to those organizations that need them. GPO, supply chain organizations in provinces, governments, public health systems, health system organizations, whether it's hospitals or communities, all have so much expertise. Here's the catch. The connectivity of what each stakeholder group understands, knows, and has expertise in has almost no connectivity to the others. So we don't know what the other guy knows, is a better way to say it. We also know there's a ton of really great work going on. Academic teams are working to define what the critical products are for health systems. Government agencies are looking to figure out what's our next generation of policies, regulatory, procurement strategies. At the same time, clinicians are seeing all kinds of shifts and changes in patient health needs at the clinical level, and their prescriptions are having to be very responsive to those needs. Consumers have very unique views of the world around what they need, what they hope for, what they're worried about, what they have confidence in, all of which comes together in a culmination of sharing those insights, expectations, knowledge, patterns of clinical processes and care practices. And when you put them all together at the same table, now we have a very full and very comprehensive picture of where do we have strengths in our supply chain, and there are some. Where are the most significant gaps and opportunities to drive forward on solutions, and how, as a group with all of those stakeholder expertise and insights, how do we mobilize those to really inform the supply resilient strategies and solutions that literally every health system in the country really needs?
And speaking of experts, we had quite a lot of experts on our this past season on Scan Health Can. We started out with Sab Di Pasquale talking about creating an agile and equitable healthcare supply chain, talking a little bit about strategic change management. Then we talked to the amazing Kathleen McMillan, focusing really in on those clinicians, the challenges that they face. How do we better integrate clinical perspectives into supply chain management? Steve Armstrong, we had the citizen and the patient involvement. How do we engage the community? Jay Myers, we talked quite a bit about, COVID-19, still top of mind, arguably still dealing with the ramifications of that. The next disruption is just around the corner for us. How do we be more adaptable? Althoff, he talked from the perspective of Mackenzie Health and talking about technology. What role does technology play in supply chain resilience? And then Ron Johnson, we talked about AI, 3D printing. I feel like I cannot have a conversation about technology without AI being brought into that. But one of the things that I kind of noticed across all of our episodes is this reoccurring theme of innovation, which arguably is not about technology. It's about bringing new ideas, methods, products, services, solutions, and of course, resilience. How do you think that these conversations that we've had can inspire and change within the industry?
Really, the underlying theme, or perhaps the underlying motivation, is people, right?
Yeah.
It is supply chain it's like the infrastructure, the critical infrastructure needed, and there are many of these, by the way, but the critical infrastructure that every health system must have in place in order to have the capacity to deliver safe and high quality patient care that is accessible and is able to meet the needs of every Canadian when and where those health needs are required. But the second group of people, and it's by no means an ordering here, but just as critically, enabling a workforce in our health systems to do what they do best, and that is to deliver fabulous care. They can't do that without a highly dependable and resilient supply chain, so that no matter what happens in that global supply chain, and wow, there's a lot of options for things that can go wrong or disruptions that occur, regardless of what occurs, that clinician, that team, that organization has what it needs, or it has alternatives to what would normally be used to ensure that every patient gets care delivered. So for me, no matter which, you listed a wide range of perspectives, industry, citizens, health system leaders, data experts, supply chain experts, all of them, they all converge on that central critical mandate of supply chain, is to ensure that every Canadian has access to the care and, by definition, the products required to deliver that care when and where it's needed. And that is about safety, that is about patients' lives. If you don't have that imaging contrast dye available in the city you happen to access your next diagnostic imaging examination, then that diagnosis is delayed. A delay in diagnosis always means a poorer outcome, pretty much, for that individual, to say nothing of the stress they go through and waiting and worrying, when will I get this CT scan, or when will I get access to that imaging center when they get the products they need to do the diagnostic test. So it's really about people. It's really about the confidence in the workforce that they will have what they need to deliver great care, not just do our best, wing and a prayer kind of thing. And the confidence among Canadians that when they need that health system and the care that that system offers, that it will actually be there.
How do you envision Scan Health continuing to contribute to the conversation? As you outlined and I outlined earlier, we had a lot of key stakeholders that contributed to this conversation, but how do you envision Scan Health continuing to be involved in this conversation? And what do we hope to see in the next coming years?
It's beyond a conversation, and that's first and foremost. We all in healthcare systems are, we describe the challenges in healthcare and have done so, I would say, for the better past of the last 100 years, particularly the last 50. We talk a lot about what could be better. It's not about the dialogue, although the dialogue's critical, don't get me wrong. What it's really about is bringing those stakeholder groups that have never had a chance to sit at the same table and creating the conditions for those stakeholder groups, partners, quite frankly, to design the solutions. So it takes all the dialogue, moves it to a collaborative co-design strategy with every one of those sources of expertise, knowledge, insights, needs and demands, if you will, at that table. And they design the solutions they are most able, most value, but also see as most feasible to advance and achieve a stronger, more resilient supply chain. So it's Scan Health is the organizing team that creates the conditions for these partners to come together and to be very highly successful in developing and designing the solutions, the strategies to strengthen supply resilience for every organization to ensure that those systems, health systems, that workforce can execute on their mandate actually to deliver care when and where it's most needed for every Canadian.
Looking ahead, what do you think some of the major challenges and opportunities you see for Scan Health and, of course, the broader healthcare supply chain community?
For Scan Health, our work is, and it's always a challenge, when you design solutions, those solutions can only be effective if they are implemented at scale. So our challenge is, as an academic team primarily, is don't simply just create the forum for designing those solutions. It's engaging with our many partners, over 100 partners across the community of practice, to work with us to embed and scale those solutions so that they become a reality and they really do advance supply chain resilience for Canadians. So I would say it's a collective challenge. And the challenge is always about implementation at scale. We can co-design, we can pilot test, we can create the evidence that these solutions have very specific areas of impact and value for health systems. It will take all of us, every partner and their partners, their respective networks of partners, to implement, scale, evaluate. Have we got these solutions right? How can we further improve them as health system supply chain resilience advances? And the other part of that challenge is you never quite know what that future holds, right? There are many uncertainties in the global supply chain that health systems work within. Uncertainties like environmental events. No one I know of is able to predict the next tsunami, the next fire, the next earthquake, the next environmental event that completely knocks out a supplier or a manufacturer's ability to produce those products. You have geopolitical challenges. We see that now in Europe that I don't think 5 years ago any one of us would have predicted, but it impacts global supply chains. So there are many challenges and uncertainties ahead of all of us that will not go away. It's a very dynamic global supply chain environment that virtually every health system in the world must rely on. The only critical question is, how do you prepare for, put plans in place so that despite any one of these challenges that may unfold, we're prepared, we have strategies, game plans, plan A, plan B, plan C, those kinds of things that can respond with agility, with flexibility, and that responsiveness is so rapid that the average health system organization or even our patient would not even notice there's a significant supply disruption. And that's really where supply chain resilience needs to get to. That's a tall order. It's not a small agenda. The complexity is exceptionally high. The uncertainty, similarly, quite dynamic and very high. But that goal, that mandate is something I think the community of practice has been able to really define very clearly with our partners and advance some of what we're finding are very critical supply chain resilience solutions that are most needed.
You had a crystal ball and a magic wand. What would you see in 10 years? Where would Scan Health be? Where would we be as an industry? If you could teleport or had some magical um, way of seeing that, what do you hope to see? What do you think we will see in our future?
I actually think the critical question is, where will we be with supply chain resilience in 5 or 10 years? That's the bigger question. How and who gets there, whether it's Scan Health Community Practice or some other combination of stakeholders. Where I think we can be, and we really hope to be within 5 years, perhaps a little longer, is we have a network of domestic manufacturers and suppliers within Canada's borders that can meet a number of, not all, but a number of the supply chain needs of our health systems. Second, we have a very robust and sustainable workforce who has confidence in the supply chain resilience, and that they are well aware and they have an active role in decisions on how to advance and strengthen resilience of our supply to ensure every patient gets what they need. We have a highly developed supply chain surveillance system, one where we know where the risks are for supply chain shortages or potential disruptions, and that data informs proactive strategies to mitigate the risk of those disruptions, to ensure there's a seamless flow of products right to the clinicians, patient care teams who most need them. I would hope for, but this one might be longer than 10 years, a very highly transparent, digitally enabled supply chain, so that anywhere in the country, supply chain teams, health system leaders know, what supplies do we have? Where are they? Who needs them most? And how do we make sure none of them go into a shortage situation, which puts our patients at risk? To do that, you have to have very resilient and very creative sourcing and procurement strategies. You don't ever rely on one source of product. For example, you have multiple sources from different geographies to overcome risks like environmental events. And all of that is driven by, supported, and enabled by a strong multi-jurisdictional leadership strategy, where all of the provinces, territories, federal government agencies, and teams come together to ensure that that supply resilience is responsive, it's agile, it optimizes supply chain services and management, risk management in particular, and ensures that we can withstand even the most challenging disruptions to supply shortages, climate events, uncertainties in different parts of the world, so that every Canadian, every clinical clinician and workforce can be confident that our Canadian health systems can and will meet the health needs of every Canadian. That's a big crystal ball, but those are where our community of practice, with our many important partners, are very committed to achieving, and again, implementing those tools and those solutions at scale, so no one's left behind and everyone has the confidence in Canada's health supply chain.
That does sound like a tall order, but I know that we can do it, especially supported by you and Scan Health. And I always say a journey of 1,000 miles, or in Canada, you say kilometers, or whichever, we start one foot at a time. So what is that one next step that Scan Health is going to take? And what are your goals for the coming year?
Our next step is, we have been very fortunate to have worked very closely with our partners on this 6 work groups in the community of practice. The Leadership and Policy Group has defined and is just about to finalize that multi-jurisdictional collaboration strategy to lead supply chain resilience across the country. We hope to pilot test and begin pilot testing that strategy this upcoming year to see what we got right, where we can strengthen and improve, and then where it can be implemented again at scale to achieve value. Our sourcing and procurement work group is really close to identifying those sourcing and procurement best practices that create the resilience we need in our supplier community, making sure we have the suppliers we need, bringing their amazing products to the Canadian market, which is not a small challenge. We are, as you just pointed out, one of the largest land masses in the world, with one of the smallest populations living in that land mass, which means you have to distribute products far and wide. Digital supply chain, advancing, and this one's going to take longer, I think, but we've mapped what are the features of a digital supply chain. What does it look like, and how would a health system know if they've achieved a digitally enabled supply chain? That's getting ready for a pilot test with a number of health systems to see if that type of a digitally enabled mapping helps them understand where are they today and where do they need to get to, because that will be critical to provide and supply or to drive that data-driven approach to supply chain management in health systems. And the domestic supplier network, when you talk to most partners in Canada, they don't know where our Canadian companies are. They don't know what they produce. They don't know what their manufacturing expertise is. And if you don't, then how is it that health systems can support our domestic suppliers? And we need to support them. Not only does it drive our economic growth in Canada, but it gives us a sense of confidence that we have the manufacturing capacity within our borders, so that if we ever find ourselves in a position where products cannot easily cross borders into Canada, then we have some resilient backup systems in place. And the workforce, we're close to pilot testing a communication strategy. How do we make sure every clinician who needs to understand what that next risk is around a supply disruption, how do we communicate with them? How do we make sure they're aware so they can shift their practice routines? And how can we mobilize their expertise to have input into what are the dependencies? What are the backup solutions that we can put in place clinically to make sure patients get the care they need? And then the last one, supply chain security and sustainability. We've designed at a high level a very interesting, I think a first of its kind, surveillance system. What are the data points we need to track and monitor whether there are, in fact, emerging risks in our supply chain? That will be fine-tuned this upcoming year. I'm very excited about being able to pilot test that with some of the partner organizations to see if it in fact works. And preferably, does it work across jurisdictions? Because Canada up until now has worked very much long and deep in these areas within a jurisdiction, but our populations are so small. Where we really need to get to on that surveillance is sharing what people are seeing across the country so that everybody has the opportunity to be prepared for a disruption or has those strategies in place to manage a disruption. So we're very much fine-tuning and finalizing our solutions to advance resilience, and we're very excited this upcoming year to move towards, let's test them, let's road test them, make sure we've got it right, learn from that pilot testing, and move towards a much more scalable solution in each of these areas.
Well, Anne, I want to thank you for your fearless leadership of Scan Health in driving this forward. And certainly we want to make sure we thank all of the partners that we have that help Scan Health and help the community of practice continue to move forward. Any final thoughts, Anne, before?
Oh, thank you so much. And you make a very important point. Scan Health is just the team that creates those conditions for these partners to do the incredible work they're doing. It is all about this community of practice. And it's a wonderful, really, testament to bringing all stakeholders together to a table, makes these very significant challenges and solutions to overcome challenges possible. And I will always and continue to be so grateful for our partners' commitment and their time and their insights and most of all, their inspiration.
Well, thank you for joining us today on this finale episode of Season 1 of Scan Health Can. We've had an incredible journey this year exploring the healthcare supply chain with visionary leaders and experts. If you missed any episodes, be sure to catch up on all of our discussions. Stay connected with Scan Health, subscribe, share, and join the conversation. Till next time, I'm Dana Trampas signing off from Scan Health Can.